I firstly want to join with the previous speakers in complimenting those that are on the front line in the delivery of these vaccines, and even those that are close to that front line in managing it and so on. There's a growing confidence about the vaccine and a growing desire amongst a lot of people to have that vaccine and to have it delivered as soon as possible. However, there's an issue around how we deliver that message. And the message, at the best of times, has been confusing. I think that we have to be clear on our messaging. We have to inform people of what we expect is going to come, and then we have to inform them as to what is here and has arrived. And out of what arrives, who is going to be vaccinated next. People are watching the space very carefully because it's a health issue for them, and they want to see that clarity. Those that have been vaccinated, that have received their first vaccination and have got an appointment for the second jab, that appointment should be kept. It should not be cancelled. And there's a fear that it very well may be cancelled. So I would like to hear some clarity around that particular question for those people. I am disappointed that we continue to hold the position that we will not deal with carers, those that are involved in frontline education, or the guards or the teachers. I think to gain the confidence of everyone, we need to listen to what they're asking, and we need to understand that, even to the extent that those who may not want a particular vaccine, that they will be encouraged by the evidence to look at the vaccine they've been allocated, but where that's not possible, that another vaccine should be considered for them. So I would ask you, Minister, to listen more carefully to what is being said in this House, indeed in parliamentary party meetings. It may be a different point of view than yours, or than all of the professionals you listen to. But it is a point of view, and if we want to bring the people with us, then that's what we have to do. And one voice in relation to the messaging would be helpful. I appreciate you have your shadow minister on your shoulder from your own constituency, and that we have three parties in government. But the fact of the matter is, we have to respect the people. And in respecting the people, we have to address their concerns and their issues. I would really ask you to look at, in terms of opening, to look at the whole issue of religious ceremonies, of that devotion, that mass, or it may be the mosque and so on, because that is hugely important for the mental health and well-being of people. And I would ask you to look at the mental health issues that are arising now, and the facts that people cannot get appointments to be assessed, they cannot get appointments to have their medication reassessed, and they are facing into a very, very dark space when they don't hear the government speaking to their case and making the appropriate changes that are necessary for their care.
Deputy